In this video, we will be discussing the various types of assessment, diagnoses, and treatments in psychopathology, otherwise known as abnormal psychology. We will begin by discussing and defining the different types of assessment. So what does assessment mean? According to this text, it means a collection of relevant information to reach a conclusion. And so there are different types of information known as idiographic and employment screening. The second type of assessment is clinical assessment, and that's when information is used to determine whether or how and why a person is behaving in a dysfunctional manner and how that person may be helped. As you can see, on the first type of assessment, there's what's known as idiographic information. And idiographic information refers to a particular individual as opposed to a larger population. So the clinician or the therapist seeks to answer the question, how and why is the client showing psychopathology? And they answer those questions by using assessment tools. As you can see here, there are quite a few. It says hundreds of clinical assessment tools have been developed and fall into three different categories. The first category is clinical interviews. The second is clinical tests. And the third is clinical observations. So those are specific tools used in an assessment. They depend on the clinician's theoretical orientation. So what are the characteristics of assessment tools? And the characteristics, when I use that term, that's basically seeks to define what are useful tools that must be standardized and have clear reliability and validity. And standardization involves setting up common steps to be followed whenever it is administered. So going forward, we'll be talking about reliability, and that's the consistency of an assessment measure. So a good tool will always yield the same results in the same situation. And there are two main types of assessment tools, and those are called retest reliability. That's when the test yields the same results every time it is given to the same people. The next type is called inter-rater or inter-judge reliability, and that refers to basically when different judges independently agree on how to score and interpret a particular tool. Another characteristic of assessment tools is what's known as validity, and that just refers to the accuracy of a tool's results. So an assessment tool must accurately measure what it's supposed to measure, and there are three specific types of validity. The first is face validity. That's when a tool appears to measure what it's supposed to measure. It does not necessarily indicate true validity, though. The second type is what's known as predictive validity, and that's when a tool accurately predicts future characteristics or behavior. The third type is concurrent validity, and that's when a tool's results agree with independent measures assessing similar characteristics or behavior. In this slide, we will discuss what's known as the clinical interview, and that's often the first contact between the client and the clinician. It's used to collect detailed information about the person's difficulties and feelings, their lifestyle and relationships, and other personal history. And that may include client expectations and motives for therapy. So going forward here, we will discuss we'll elaborate just a little further on conducting the interview. So there's what's known as the face-to-face encounter. And during that face-to-face encounter, basic background data is gathered with a specific theoretical focus. And some of those focuses might be psychodynamic, cognitive behavioral, humanistic, and biological. And there's what's known as unstructured. Unstructured interviews typically appeal to psychodynamic and humanistic clinicians. The other type is what's known as structured. And structured is primarily focuses on specifics. So what are some of the limitations of clinical interviews? And we can see it says lack of validity or accuracy. There may be interviewer bias or mistakes in judgment, and a general lack of reliability. And because different clinicians can obtain different answers and draw different conclusions, even when they ask the same questions of the same person, some researchers believe that interviewing should be discarded as a tool of clinical assessment. We will proceed a little further by talking about some of the different types of clinical tests and what are they. So clinical tests, they are used to gather information about psychological functioning from which a broader information is inferred. So clinical tests, we want to keep in mind those are the devices that the clinician uses to gather information about a few aspects of a person's psychological functioning, and then they will be able to infer broader information as a result. Going to the next slide, we will talk about some of the different types of clinical tests. The first of these is what's known as the projective test, and that requires the client's interpretation of vague or ambiguous stimuli or open-ended instruction. It has a psychodynamic orientation. So as we can see here, I gave some examples like the Rorschach test, thematic apperception test, sentence completion tests, and drawings. And these are all projective tests. That's a test that consists of ambiguous material that the client will interpret or respond to. On the next slide, I'll give you an example of the Rorschach test. The Rorschach test looks like this. The client is presented inkblot cards and they are asked what they see. Special attention is paid to themes and images noted and style of responses. Moving forward, we will discuss projective tests, another type known as thematic apperception tests. And that's when a client is shown 30 cards with black and white pictures of individuals in vague situations and asked to make up dramatic stories about each card. Here's an example. And that is called pictorial projective tests. Another type of projective test is what's known as sentence completion tests and drawings. So a sentence completion test, the client completes series of unfinished sentences. In the drawings, a client is evaluated on the basis of their drawing details. So evaluations of these drawings, they're based on the details and shape of the drawing, the solidity of the pencil line, the location of the drawing on the paper, the size of the figures, the features of the figures, and the use of background, and the commitments made by the respondent during the drawing task. Closely related is what's known as the draw a person test, and that's the most popular type of the drawing test. The individuals are first told to draw a person and then to draw a person whose gender is different from the first drawing. I will show you an example on the next slide. It looks like this. These drawing tests are commonly used to assess the psychological functioning of children. And as part of a therapy program, this young refugee draws an attack scene. Going forward, we will answer what are some of the merits of projective tests. Well, some of the strengths of projective tests are the most commonly used tests for personality assessment, and they are now used to gain supplementary information, although they are shown to be somewhat limited in reliability and validity, is not consistent. It might be biased against minoritized racial and ethnic groups. Another type of clinical test is personality inventories, and those are designed to measure broad personality characteristics. And so usually the client is asked to respond to questions that focus on their behaviors, their beliefs, and their feelings. It's usually based on self-reported responses. And clinicians use these responses to draw conclusions about the person's personality and psychological functioning. So what are some of the advantages and limitations of personality inventories? Well, some of the advantages are that they're easier, they are cheaper and faster to administer than projective tests. They have greater retest reliability, and they appear to have greater validity than projective tests. On the other hand, some of the limitations of personality inventories might be, Well, they cannot be considered highly valid. They don't allow for cultural differences that might be in effect. So despite such criticisms of the personality inventories, they still continue to be popular. And so research indicates that these can help clinicians learn about people's personal styles and disorders, as long as they are used in combination with interviews and other assessment tools. Another type of clinical test that we will discuss is what's known as the response inventories. In response inventories, usually based on self-reported responses, they focus on one specific area of functioning. So according to these examples, they measure affective inventories, social skills inventories, as well as cognitive inventories. Elaborating upon that, some of the limitations of response inventories might be, well, they do have strong face validity, but few have been subjected to careful standardization and reliability and/or validity procedures. Another type of clinical tests that we will discuss is what's known as psychophysiological tests. And they measure physiological response as an indication of psychological problems. So they will measure things like heart rate, blood pressure, body temperature, galvanic skin response, and muscle contraction. And some closely related, as you can see here, the polygraph might be something that would be found to be useful. So what are some of the limitations of these psychophysiological tests? And those limitations are that the test might require expensive equipment that must be tuned and maintained. Measurements might be inaccurate and unreliable. Laboratory equipment might be frightening to the individuals. And physiological responses may change when measured repeatedly in a single session. Elaborating a little further on clinical tests is what's known as neuroimaging. In neuroimaging or brain scanning techniques, they assess brain function by directly assessing brain structure and activity. So according to this picture right here, this is part of a study that was conducted with a mother and her 5-year-old child who has autism. And so the sensors that are attached to their scalps, they help measure their brain waves, and these measurements are later compared to those derived from other mothers and their non-autistic children during similar interactions. So some of the variations in scanning might be these here. We can see an MRI machine, MRI scan, a CAT scan on the lower middle row right here. And then on the right-hand side of the lowest row is what's called a PET scan, which stands for positron emission tomography. So In this photograph right here, the doctor on the top is preparing a patient for an MRI procedure. And that helps produce pictures of the living brain. Now on the lower left-hand side, this is an MRI scan picture. This image right here shows the image of a typical functioning brain. On the middle, the CAT scan, that reveals a mass of blood within the brain. On the right-hand side, the PET scan shows which areas of the brain are active. So those colored in red, orange, and yellow, those are the active areas. And that's a result of the individual being stimulated. Another type of clinical test is what's called the neuropsychological test. And that's a test that detects brain impairment by measuring a person's cognitive, perceptual, and motor performance. And brain damage is especially likely to affect visual perception, memory, and visual motor coordination. So neuropsychological tests focus particularly on these areas. Moving forward, we will discuss the different types of clinical observations, and those are called naturalistic and analog. So a naturalistic observation, those are what occur in everyday environments. It can occur in homes, schools, institutions like hospitals and prisons, for example, as well as community settings. And most of those focus on parent-child or sibling-child or teacher-child interactions. If, on the other hand, naturalistic observation is impractical, analog observations are used and conducted in artificial settings. So what are some of the limitations on clinical observation techniques? So those limitations might be the fact that observations are not always reliable, and validity or accuracy of observations may occur. I give some examples here, what's known as observer drift, observer bias, client reactivity, and cross-situational validity may be lacking. So going forward on our discussion about clinical observations, there is what's known as self-monitoring. That's when people observe themselves and carefully record the frequency of certain behaviors or feelings or cognitions as they occur over time. And those have shown to be useful in assessing infrequent or overly frequent behaviors, provides a means of measuring private thoughts or perceptions. So when using all the available information that they are able to acquire, clinicians attempt to paint a cluster of symptoms, which is called a syndrome, and then they will make a diagnosis. And a diagnosis is a determination that a person's psychological problems constitute a particular disorder, and that is based upon a classification system. So the most common manuals that a clinician will use in order to make a diagnosis is what's known as the DSM-5. And the DSM stands for Diagnostic and Statistical Manual. And the 5 means the 5th edition, which was published in 2013. It listed more than 500 mental disorders. Each entry described the criteria for diagnosing the disorder and the key clinical features of the disorder. So this is a classification system. Now, looking down further on the screen, there's something in 2022, something called the DSM-5-TR. That's the amended version. It basically updated DSM-5's background information, text information. So it added a new mental disorder, which is called prolonged grief disorder. And this DSM-5-TR provides deeper discussions regarding to the impact of things like racism and other kinds of discrimination on mental disorders. Elaborating a little further on DSM-5-TR, there's what's known as categorical and dimensional information. So what does that mean? Categorical means the name of the category of the disorder indicated by the client's symptoms. But dimensional information refers to the rating of how severe a client's symptoms are and how dysfunctional the client is across various dimensions of their personality. So elaborating just a little further on that, categorical information includes, some of the most frequently diagnosed disorders that are shown like anxiety disorders and depressive disorders. So the clinician, when they are regarding this categorical information, they must decide whether the person is displaying one of the hundreds of psychological disorders listed in the manual. Going further, we will elaborate on dimensional information. And dimensional information, remember, is assessment of current client disorder severity. And that consistently seeks both categorically and dimensional information. The DSM-5-TR is known to be equally important in the diagnosis of these disorders. So is the DSM-5-TR an effective classification system? And the DSM-5-TR has retained several of the validity problems that have been found to be in past editions of the DSM. So proponents of this model believe that the DSM's primary emphasis on distinct psychopathology categories or mental disorders, it does not sufficiently capture the dimensional nature of psychopathology. Remember, the dimensional nature refers to the degrees of severity and frequency that the client is experiencing. So can diagnosis and labeling cause individuals harm. Misdiagnosis and reliance on clinical judgments, that can be a concern, and classifying may be a stigma and lead to a self-fulfilling prophecy. Going further, on the next slide, here we will see another problem related to diagnosis is the prejudice that labels arouse. Might be damaging to the person who is diagnosed, giving them a label. So over the years, various editions of the DSM have incorrectly listed certain alternative patterns of functioning as being pathological. For instance, transgender people, non-binary people, and those who experience what's known as gender dysphoria. On this next slide, we are going to talk about treatment. So how might the client be helped? So treatment decisions begin with assessment information and diagnostic decisions to determine a treatment plan. And both that uses a combination of idiographic and nomothetic information. And there's other factors involved too, like the therapist's theoretical orientation. What does current research tell us about this treatment? And the general state of clinical knowledge that tends to focus on empirically supported, evidence-based treatment, which is an important step in the scientific method. So what other factors contribute to therapy outcomes? Well, we can see, events in the client's life, 30%. Specific therapy techniques, 15%. Expectancy of the therapy success, 15%. And feel free to pause the slide here and look at this on your own time, okay? But according to research, a client's progress in therapy relates only partly to the specific strategies used by the therapist. In fact, factors such as the client's expectations, the client-therapist relationship, as well as current events in the client's life, they may collectively have the most influence on the outcome of the specific type of treatment. So looking at some of the current information, we will answer a few questions. The first question is therapy in general effective? So people in therapy have been found to be better off than people with similar problems who receive no treatment. The second question is, are particular therapies generally effective? And the latest has shown that various therapies do not appear to be that much different than others in their general effectiveness. The third question is, are particular therapies effective for particular problems? And the latest research answers, well, certain therapies or combinations of therapies do appear to be more effective than others for certain disorders. So as we were examining the current research knowledge, we will seek to answer this question. So what lies ahead for clinical assessment? Assessment is increasingly being used through the full course of treatment, as opposed to only at the outset of a treatment. So things like, I give this example on the second one, I said brain scanning techniques continue to offer assessment information about an increasing range of psychological disorders, which results in an increase in research. On the bottom here, I said rising costs and health insurance concerns and economic factors may limit the use of assessment tools. So this concludes our discussion on this video. Thank you for joining us, and best wishes.